chapter 21. Now let's talk about the genitourinary tract and its definitions. So the genitourinary tract contains two parts. One is the urinary tract, another is the genital tract. Urinary tract actually removes the waste substance from the body. So it consists of the kidney, urethra. So the genital system actually, so this system makes the next generation. Urinary tract consists of a kidney. Kidney actually filtrates the blood to filtrate the waste substance. Urethra actually is the tubular organs link the kidney to the bladder. So bladder is just organ to store the urine. Urethra is opening duct so that eliminates the urine from the body. So in males, the urethra is the terminal organ of the reproductive tract. In the female, so the urethra is separated from the reproductive tract. So this is female. We can see this is kidney, and this. So the kidney, this is kidney. So this is urethra. This is bladder. This is urethra. Since the urinary tract is opening to the environment, so it has its own defenses to prevent infections. So the first defense is non-specific. So for example, the flushing. So once the urine flush out of the urinary tract, actually it can carry the microorganism out of the urinary tract. Also, the urinary fluid can shed the epithelial cells from the urinary tract. Actually, so the microorganism colonize on the epithelial cells. So once epithelial cells is shedding off, so by the urinary flow, so actually, so this mechanism diminishes the chance for the microorganism localizing on the urinary tract. However, urinary tract does has the microorganism live in there, so this is called normal biota. However, the biota in the urinary tract is different from that in the GI tract. That's because urinary has its specific characteristic. Urine is acidic fluid. Okay, it contains the lysozyme. So lysozyme can break down the peptidoglycan, lactoferrin. So this is iron-bound protein that can inhibit the bacterial growth, and IgE secretory IgE that can neutralize the microorganism. The male reproductive tract also make transport sperm cells. Also makes male hormones. Male reproductive system contains testes. Testes produce sperm cells, hormones, epididymides. So this is coiled tubes leading out of the testes. It is also the organs let the sperm cells to be matured, but differ. So this is combined. What's different combined with the seminal vesicles and terminate into the ejaculatory duct. Then the ejaculatory duct will link to the urethra during ejaculation. Prostate gland is also involved in releasing semen. It can prevent the urine flow back to the seminal duct. For the mere external organs are the scrotum, penis. So penis actually holds the urethra. Scrotum holds the testes. So the urinary flow flushing is the important mechanism to prevent microorganisms colonize and grow in the urinary system. For the female has ureter, fallopian tube, ovarian, vagina, cervix. For the female reproductive system, so the female also have the innate defenses system. For example, so the vagina is covered with the mucous membrane. The mucus actually is the layer protect the vagina from infections. Also, antithesis secrete the secretory IgA antibody in the mucous membrane. IgA actually can neutralize microorganisms. Also, the vagina is acidic environment, so the pH level is 4.2 to 5. That's because the vagina secretes glycogen. Then glycogen can be fermented by the bacteria to the acid. So before puberty, however, so this process is mediated by the estrogen. So before puberty, so since estrogen level is low, so the vagina is neutral environment, is about pH 7. However, after puberty, so in the adolescence, once estrogen level increases, so more and more glycogen is secreted to the vagina, so the vagina will be acidic. So since the pH level changes, that means the biota before and after the puberty is different. Now let's work on this question. Which of the following is not considered to be an innate defense of urinary system? I give you 5 seconds. So we can see flush, yes, acidic, yes, lactoferrin, lysozyme, yes. So correct answer is C. Okay, it's C. Is C. IgA, because so that's IgA, right? IgA. Now let's talk about the biota. So the urinary system, actually the lower urethra has more biota than the upper urinary tract, because it's close to the environment, so more microorganisms will colonize in this part. However, so the biota is different between men and women, even among individuals. because the female urethra is short and it's wide. It's close to the anus, so that's why the biota is different from the male. However, for the male, so since the penis is very long, so the urethra is long, also the penis is covered by a membrane. So so the on the penis, the biota would be the aerobic Pseudomonas and Staphylococcus species. Especially for the uncircumcised penis, so more anaerobic gram-negative microorganism will be in the uncircumcised penis. So the biota is also different before and after sexual activity. So after sexual activity, the patient may get sexual transmitted diseases. So STD-related microorganisms may be found after sexual activity in the urethra, in the urinary tract. Circumcision can impact on the biota. So uncircumcision will have more microbe and more anaerobic species. For the female, so before puberty, since vagina pH is very low, so vagina pH is high, is almost 7. So the vagina biota actually is the same as the urethra. However, after puberty, since estrogen makes the acidic environment in the vagina, so the other microorganism will not live there. So the lactobacillus species will be the dominant species in the vagina. So the overgrowth of lactobacillus will inhibit the other microorganism growth. Sometimes we can also find the Candida applicans. So this table shows the biota in the urinary tract and male and female genital tract. Now let's work on this question. Which organism is the primary biota of the vagina? I give you 5 seconds. The correct answer is B, lactobacillus. Urinary tract infections. Since urinary tract has the biota also, so the urine itself is a good media for the to capture microorganisms. So if the patient have urinary tract infections, so if the infection is in the bladder, so this is called cystitis. So if the infection happened in the kidney, so this is called pyelonephritis. So if the infection is related to the urethra, so this is called urethritis. Cystitis can cause pain, urgent to urinate, dysuria, painful urination, and blood in the urine is called hematuria. The urine can be cloudy, so it's very cloudy because huge amount of bacteria and white blood cells, and fever, nausea, pyelonephritis can cause back pain. Okay, back pain and fever. So this is a severe infection, so that you need the broad spectrum antibiotics to treat. Acute uncomplicated UTI. So this means only the bladder is involved in the infection. So once the patient has the UTI, so we have to differentiate the UTI from is acquired in the healthcare facility or outside of healthcare facility, because in the healthcare facility normally, so that's the catheter procedure induce UTI. So that's why now more and more physicians recommend to decrease the catheter procedure to the patient as the minimum numbers. Since actually the 95% of UTI are caused by the normal biota of the GI tract. That's because the urinary tract has its own biota. So if the GI tract biota colonize in the urinary, so that will cause problem. So the most abundant microorganism in GI tract is E. coli. So that's actually E. coli will cause 80% of UTI. Other than E. coli, so the Staphylococcus saprophytics and enterobacteria such as Klebsiella pneumonia, Brutus mirabilis are also common. Community-acquired UTI. So it's more common in women than men because the anatomic structure. So many women has recurrent UTI. That's because E. coli invaded deeper and colonized in the upper urinary tract. So it's difficult for the antibiotic to reach to that area. So the E. coli will colonize there, and once the patient has lower immunity response, so the E. coli will cause the infections. We can use the sulfa drug to treat the UTI, such as trimethoprim, sulfamethoxazole. That's because this type of drug is eliminated by the kidney. So that's why the medication concentration in the urine is very, very high compared to the other medications. So we can use this medication to treat the UTI. We can also use the pyridinium for the UTI as well. And so this medication can relieve the symptoms such as burning and urgency. However, this one can only be administered for 2 days. Also, it can cause the urine color change. So now we have many cases of E. coli resistant to penicillin. So that could be a problem. Now let's talk about the leptospirosis. So this is the microorganism that can cause animal disease. So patient may get these infections with contacting the animal's urine. So this microorganism can affect the kidney, liver, brain, and eyes. Leptospirosis can cause fever, chills, headache, conjunctivitis, vomiting, muscle ache. So if patient has headache, so it's likely the patient will have the leptospiromeningitis, with symptoms such as kidney invasion, jaundice, neurologic disturbance. So this is the leptospirointerrogating. So this is so we can see this is the long spiral microorganism. So it has nearly 200 serotypes. So the transmission is through the contacting of the skin, operation of the mucous membrane with animal's urine. For example, in 1998, so dozens of athletes get these infections during their triathlon race in Illinois. So we can treat the patient with doxycycline, penicillin G, or the ceftriaxone, trimethoprim. So those are the medication, are very good medication to treat these patients. So once we use this medication, patient will get relief of the symptoms immediately. Now let's work on this question: which organism is not a common cause of UTI? So I give you 5 seconds. The correct answer is Pseudomonas aeruginosa. Now let's talk about the reproductive diseases. So let's talk about the both male and female. Okay, for the female has vaginitis vaginosis. For the male may have the prostatitis. So for the vaginitis, CDC have released a report of the chlamydia, gonorrhea, syphilis. So those are the highest rate cause this disease. So the disease can increase the vaginal discharge. So this is also called the discharge disease. That's because once patient get this infection, so they have more discharge. They have more discharge from the male and female reproductive tract. So there are several microorganisms that can cause discharge diseases, such as trichomonia, gonorrhea, and chlamydia. Now let's talk about the gonorrhea. Gonorrhea actually can cause urethritis, can cause painful urine and yellowish discharge. However, many patients may not have the symptoms. So in most cases, infection is limited to the distal urogenital tract. So it can also spread to the epididymis. It can cause the scar tissue formed in the reproductive system and cause infertility. In the female, it can cause the mucopurulent discharge or blood discharge, vaginal discharge. It can also cause painful urination if it infects urethra. So it can also spread to the ureterus and the fallopian tube, and also cause inflammation of the fallopian tube. This is referred as salpingitis. Once the gonorrhea continues spread to the pelvic cavity, so it causes the pelvic inflammatory disease. So this is the inflammation of the upper reproductive tract. So the gonorrhea actually can build the scar tissues on the upper respiratory tract. So this will result in the infertility of the ectopic pregnancy in females. So the consequence of gonorrhea. Gonorrhea can also spread into the bloodstream and is disseminated to the joint or skin. When it reaches to the joint skin, so it can cause the rash. Okay, it can cause the rash. So when it reaches to the joints, such as wrist, ankle, so it can cause arthritis, cause painful rashes on the limbs as well. They can also reach to the brain to cause the meningitis, and reach to the heart to cause the endocarditis. So if the pregnant woman has the gonorrhea, so they can also transmit the gonorrhea to the baby. So that's why gonorrhea had to be screened for all the pregnant women. For the baby, once the gonorrhea infects the baby's eyes, it can cause eye infections. It can cause keratitis, ophthalmia neonatal, and eventually it will cause blindness. So that's why when the baby is born, so actually we administer the antibiotics, eye drop, or the ointment on the baby's eyes. So this is a routine procedure. So if we found the gonorrhea in the children's or the teenagers or the neonates, so this is evidence of the adult sexual abuse. So we have to report this to the police department. So the gonorrhea actually is called Neisseria gonorrhea. So this is gram-negative diplococcus. Appears as a kidney bean shaped. So the gonorrhea actually So gonorrhea use fibrin to attach and anchor to the mucosa epithelium cells. So once gonorrhea anchor the epithelium cells, so they can grow and invade the cells. Eventually, penetrate the basement and get into the bloodstream of the tissues. So the fibrin actually is the most important structure for the gonorrhea colonization. Actually, the gonorrhea can change the gene coding for the fibrin. Actually, to change the antigen information of the gonorrhea. So they can avoid the immune defense. Gonorrhea also can secrete IgA protease. IgA protease can break down IgA molecules, so gonorrhea can prevent IgA neutralization. Gonorrhea can also so the gonorrhea outer member also contains the endotoxin. So that's why gonorrhea can cause the fever, all kinds of symptoms to human. So gonorrhea is transmitted through the sexual contact. So gonorrhea actually only happens in human. So it's a worldwide disease. So it causes 400,000 new cases in 2015. Many patients may not have the symptoms even they have the gonorrhea. So that's why we have to pay attention to those patients. So this patient can also spread gonorrhea to the other people. We can use ELISA and PCR to detect the gonorrhea. We can also culture the gonorrhea on the Taylor Martin agar. So the culture of gonorrhea needs carbon dioxide. We can use the catalase test and the oxidase test to identify the gonorrhea. So once patient have the gonorrhea, we have to report this to the health department and CDC. Prevention. So it's recommended to use the condom during the sexual contact. Also, we can use the so if patient since the gonorrhea is co-infected with chlamydia, so if the patient has the gonorrhea, so it's more likely the patient also has the chlamydia. So that's why we can treat both diseases together. So once we found that the patient has either one of these diseases. Chlamydia is also the report. It's also the infection should be reported. Okay, should be reported. So annually, more than 1 million infections. So that's a lot. So especially among the sexually active young women from age 14 to 19. Causative agent is Chlamydia trachomatis. It's a small gram-negative bacteria. So chlamydia lives inside of the cells, so this is obligate intracellular parasites. Chlamydia can cause mere inflammation of the urethra. Symptoms is similar to that of the gonorrhea, such as discharge, painful urination. Infection can spread to the epididymis. So the female can cause female cervicitis, discharge, salpingitis. Also can cause PID. Most of the patients with the infection don't have the symptoms. The patient who has the PID may have the acute or painful. So maybe acute or painful or may not have the symptoms. So that's why if patient have the chlamydia, so we also need to treat their partners, because they may transmit this microorganism to their partners. So once we cure, so once we cure the patients, however, so if we don't treat the partners, so partners may transmit the microorganism to the patient again. So that's why we have to treat both. So the chlamydia can also invade the lymphatic tissues and cause lymphogranuloma venereal. So the patient will have the headache, fever, muscle ache, also have the enlargement of the lymph nodes, because lymph nodes is filled with the granuloma cells. So once the enlargement of lymph nodes will cause the obstruction of the lymphatic vessels and cause chronic edema of the genital area of the anus. So this is why they common in the South America, Asia, Africa. In America, actually, we have 500 cases each year. The baby may also are transmitted by their mothers with the chlamydia. So the chlamydia can cause baby's eye infections and pneumonia. So if we don't treat the pregnant, so if we don't treat the pregnant woman, chlamydia can also chlamydia cause the conjunctivitis. So in America, so we have 100,000 cases each year. So that's why so we routinely administer the antibiotic drops of the ointments to the newborn's eyes to prevent the chlamydia and the gonorrhea and eye disease. So this is the life cycle of chlamydia. Since chlamydia is obligated intracellular parasites, so they can avoid the immune attack. So they can avoid the discharging of the phagosome in the cells. So they can also release the cytokines to induce inflammation. The reservoir of the chlamydia is human. So the chlamydia is very common, is very widely spread, especially in the adolescent woman. So chlamydia can be transmitted either through the sexual contact or the vertical transmission. That means from mother to the baby, to the newborn. So it can cause the newborn conjunctivitis and pneumonia. We can use PCR and ELISA to detect chlamydia. We can also use fluorescent antibody staining to detect chlamydia. Serology is not serology test is not reliable. Since the infections of chlamydia is so common, that means we can find the antibodies to chlamydia in the adult. Okay. Prevention. So we recommend the people keep the hygiene sexual activities. Use the condoms. CDC recommend young women screen the chlamydia because it can cause because many people don't have symptoms when they get infections, so so CDC recommends the annual screening. We can use doxycycline or azithromycin to treat the chlamydia. Once we treat the chlamydia, we also need to treat the gonorrhea because these two diseases actually cause the infection together. So after treatment, we need recheck recheck the patient in 3 to 4 months. Okay, so we need to treat all the sexual partners. Okay, because if we don't do that, so the patient will have the recurrent infections. Now let's talk about the vaginitis. So this is the infections of vagina. It can cause vaginal itching, discharge. Patient may also have the burning. A variety of bacteria and protozoa can cause this problem, even the fungi such as Candida albicans. Vaginosis is similar to the vaginitis. Candida albicans is very common in the clinic. So this is one type of fungus. Since this is built in a human, so normally it cannot cause the problem. However, if patient have the lower immune competence, so it will overgrow and cause the infections. So for the female, it can induce the variable vaginal candidiasis. So we can use the wet prep of the gram stain to detect the discharge, and then we can find the fungi. Candida infection actually is limited to the genital area. Even it invaded to the bloodstream, however, it can cause fatal can cause patient death. So candidiasis is widely found in the hospitalized patient, in the AIDS patient, because those patients have lower immune competence. So the transmission, actually, since beta is candida is normal beta, so actually. Since the microorganisms are there, so that means everyone if everyone has that, so there is no transmission. So there's no transmission route actually, because everyone has that. Yeah. So the candidiasis is opportunistic disease. So that means if patient has lower immune competence, so patient will have that. For example, for the diabetic patient, pregnant woman, or the patient use antibiotics or use chemotherapy for the cancers. So all these patients can get the candidiasis. For example, for the woman with HIV, so those patients may have the recurring infections because the immunity is very low. So there is no vaccine. So we can use azote drugs to treat the vaginal candidiasis. Now let's talk about the Gardnerella species. So Gardnerella species cause the vaginosis. So this is very common condition in the woman. So it causes the inflammation of the vagina. So this is also known as bacterial vaginosis. So the patient will have the fishy odor. That's because this bacteria will cause the fermentance of the substance in the vagina. So vaginosis is also like a condition caused by multiple microorganisms. Gardnerella can also cause the PID, infertility, and ectopic pregnancy if this bacteria spread to the pelvic cavity and the upper reproductive tract. So it can also cause this problem. So it is very common in the sexually active woman. Since it's associated with sex, however, since the bacteria actually can be found everywhere, so actually it's not considered as a transmitted disease, okay, because everyone has that. So it's more likely caused by the penetration without the semen. Okay, without the semen. So actually, so why the so why the Gardnerella overgrowth is still unknown. Okay. So if we so how do we diagnose this disease? So we can observe the vaginal discharge. So if we found the huge epithelial cells attached with numerous bacteria, so this is called crucius. So if we found this, so we can make the diagnosis. So this is the microscope view of the crucius. Since the patient has the symptoms, so we have to treat the patient. So if the woman use intrauterine devices, so that so the IUD may be the pathway for the bacteria to get into the pelvic cavity of the upper reproductive tract. So actually, we have to remove the IUD and give the patient medication to treat this. We can use metronidazole or the clindamycin. Trichomonas vaginalis is a small pear-shaped protozoa with anterior flagella. It can cause asymptomatic infections. So if the male gets infections, however, most of male patients won't have the symptoms. However, the female will get the white and green discharge. So if a patient has the chronic Trichomonas vaginalis, so that's may be a clue. That means the patient may have the HIV. So the chronic Trichomonas can cause infertility. It can also induce premature labor of the low birth weight infants in the pregnant woman. So the trichomonas is transmitted through the sexual contact. Prostatitis is infections of prostate glands. So we can classify as acute and chronic prostatitis. Prostatitis is induced by the bacterial infections. The bacteria are the normal beta from the GI tract can cause this. So if a patient has a long term of infections, so this is chronic prostatitis. So the patient, so it's difficult to treat the chronic prostatitis. So patient will not have the response to the antibiotics. Patient will have the pain in the groin, urgent to urinate, difficulty urination, blood urination, painful ejaculation. So we can treat the patient with ciprofloxacin and levofloxacin. Now let's talk about the genital ulcer diseases. So we have three types of diseases. So those are the syphilis, cankerous, genital herpes. Since these infections can cause the ulcer lesions on the skin, so this is called genital ulcer disease. Once patient have these infections, we also have to think about HIV, because the ulcer lesion is good transmission route for the HIV evasion. Syphilis. Syphilis can be classified as primary, secondary, and tertiary syphilis. Syphilis is spiral shed. We can find the spiral shed in the lesion or the blood culture during the primary and secondary stage. So the transmission is through the sexual contact. So the primary and secondary stage has capacity to transmit the microorganisms. Primary syphilis means so that means the first time of the microorganism invaded the patient. So the invasion site can so we can find the hard canker in the invading site. So this is a huge ulcer without pain. So if we find this sign, so this is a very good sign for the syphilis. So the canker can heal spontaneously without a scar in 3 to 6 weeks. So once the canker disappears, that means the spiral shed actually invaded to the tissues and bloodstream. Secondary syphilis appears after 3 weeks to 3 months to 6 months after cancer healed. So it can invade too many systems, cause fever, headache, sore throat, lymphadenopathy. Okay, it can cause the rash. So the latent and tertiary syphilis can last for many years, such as 20 years or longer. So we can detect the syphilis antibodies in this stage. So so in this stage, actually, the syphilis can cause many pathological complications. It can also, once it invaded to the cardiovascular system, it can cause the cardiovascular syphilis, such as it can invade to the aortic ring, cause the murmurs. It can also invade the artery and cause the artery wall weakness. So the artery can be distended, can cause and eventually cause the fat rupture. So once syphilis invades the valves, so it can cause the heart failure. So the gametes is painful swelling, syphilitic tumor. It can be found in the liver, skin, bone, cartilage. Congenital syphilis. That means so once the if the pregnant woman has syphilis, actually the syphilis can invade to the placenta and invade to the fetus tissues. So the infection will cause the congenital syphilis at any time of the pregnancy. So syphilis can inhibit the fetus growth and inhibit the fetus development. Also can also cause the fetus defect and cause the miscarriage or the fetus death. So the infant can have the nasal discharge, skin eruptions, bone deformations, and nervous system abnormalities. So the patient may also, so the baby may also have the problem in the bone, eyes, inner ear, joints. Also have baby may also have the defect of the teeth. So this is called Hutchinson teeth. Syphilis is induced by the Treponema pallidum. So this is a spirochete seeing regularly coiled microorganism, gram-negative staining, and so this is so this is so this is strict parasite needs the living host cells. Syphilis can invade the human through the mucous membrane by its hooked tip. So once they invade the skin, so they can cause the cankry, and then penetrate to the capillaries. So from capillaries, so we can move to the bloodstream and reach to the other organs. So even the syphilis can cause the immunity response. So the human can generate the antibodies for the syphilis. However, the immune response cannot actually kill the syphilis. So the syphilis only infect the human. Okay. So syphilis need to live in the host, in the human body, so it cannot survive outside. So syphilis can be killed by heat, drying, and disinfectants, soap, high oxygen tension, and pH change. So this means we can easily cure the syphilis with household hygiene products. So syphilis can survive for a few minutes to hours in the body secretion. Survive longer, 36 hours in the blood. So the transmission route is the sexual transmit. So So the infection rate is 12% to 30%. Syphilis is a reported disease, so we have to report to the health department and CDC. So it's still worldwide problem, especially in Africa and Asia. So we can find the specialized with the microscope and with the dark field view. However, it's not for example, we can see this. So this is syphilis. However, it's not a guarantee to see this spreadsheet in every patient's samples. So that's why we can do the RPR test. RPR means the rapid plasmin reagent test. So this is the immunoassay test. So we can use this to detect the syphilis. So the prevention is to keep the personal hygiene, sexual activities, use the condom. So even if the people don't have this preventional precaution, so they will be considered as patient with the high risk of infection of syphilis. So if the patient consider they get the infections, even they don't have the infections, so we can still give the patients penicillins. So this is single dose to prevent the syphilis invasion. So the condom can protect people from infection very well. Until now, there is no vaccine. So in the history, the human have used all kinds of medication to treat the syphilis, such as so we also use arsenic products to treat the patients. So now we use ciprofloxacin and levofloxacin. Cankra is the second genital ulcer disease. So cankra began as the soft papules or bumps, and then developed to the soft concrete. So this is soft concrete, so which is painful in the man. It can cause the enlargement of inguinal lymph nodes. So it is induced by the hemophilus decree. That's because it can induce the pain that cause men to cry. So this is pleomorphic gram-negative rob. It has the hemolysin to induce the cancri. It's common in the tropical subtropical area, but now it's become common in the US. So it's transmitted through sexual contact. So it's widely found in the sex worker and patient with poor hygiene. So uncircumcised men has more prevalence than the circumcised man. Now let's talk about the herpes. So herpes can cause ulcer lesions on the skin, on the skin of the genitalia area, perineum, thumbs, buttocks. So the lesions are small and so initially it caused the vesicles rash, small vesicle rash filled with clear fluid. Once the the vesicles are ruptured, so it causes ulcer. It causes ulcer lesions. The patient may have systemic symptoms such as malaise, anorexia, fever. So initially, patient may not have the symptoms, so they just have the vesicles rash. So the herpes actually can colonize in the neurons. So actually, it cannot be cured. Okay, so it can cause recurrent episodes of the disease. So herpes, actually, the infections of herpes is very common. So actually, most of patients don't have symptoms or even don't have any rashes. However, so it can cause 1 or 2% per million patient get the encephalitis. So if the pregnant woman has the herpes can also invade the fetus and cause the fetus death. So that's why the herpes should be screened for all the pregnant women. So the pregnant women, if pregnant women have the herpes infections before, the woman should be monitored carefully for any lesions, especially in the last 4 weeks. So if no recurrence signs, so we can do the vaginal birth, so vaginal delivery. So if the woman has rash, lesions, outbreak of the recurrence, so we have to do the C-section. So there are 2 types of herpes, HS1, HS2. So actually, both can cause the genital herpes. Herpes 1 is considered as the infections on the oral mucosa, originally. So this is called the cold score or the fever blister. So the herpes 2 is considered as a genital virus. However, they can both cause the oral and the genital infections. So the herpes infection actually is latent. It can last. So it can actually the virus cannot be cured. Okay, so the infection can be very long time. So the virus actually colonizes in the neuron, so it can cause recurrent infections. So those conditions can cause recurrence, such as stress, UV radiation, injury, um, menstruation, and another bacterial infections can also cause the recurrence of the herpes. Herpes is widely is very common. 4 billion out of 7.5 billion are infected in the world. So the herpes is very sensitive to the environment. That means the virus cannot survive in the environment. So they have to live in the host cells. So the transmission is through the contact. Herpes can be transmitted even without a lesion. So they can still transmit. It can still be transmitted. Even the herpes is more common than the chlamydia and gonorrhea. However, it's not a reportable disease. So we don't need to report the herpes patient to the health department and the CDC. So if a patient has the classic skin lesions, so we can make the diagnosis. However, if a patient don't have skin lesions, so we can do the PCR to detect the virus genes. Otherwise, we can also use ELISA antibody to detect the virus. Prevention. Actually, there's no vaccine. There's no vaccine. So avoiding contact from the infected patient. Condom can also provide the protection. If a mother has a cold sore, so it is recommended that the mother don't kiss the baby. We can use so there are the medication available to treat herpes, such as acyclovir. So it's a very good medication to inhibit the virus and eliminate the symptoms. However, the virus cannot be fully eliminated. So the disease will be recurred again. Now let's talk about the human papilloma virus. So this disease can cause the VAT. The VAT is outgrowth tissues on the genital area. So in female, it can happen on the vulva and the vagina. In the male, it can happen in the penis and the scrotum. So they can also happen on the anus and the skin. So those are the tiny flat inconspicuous bump. So this is called condyloma acuminata. It's like cauliflower masses. So this virus can also infect the cervix. the infection actually doesn't have any symptoms. So this is silent, okay? This is silent infections. However, it can cause uh, the change of the cells. It can cause the malignancy change of the cells and eventually cause cervix cancer. So each year, so in America, we have 4,000 women died on the cervical cancer. So the male can also get cancer from the HPV infections, especially on the penis and anus. HPV can also cause the oral and throat cancers. So the HPV virus is no enveloped DNA virus. So it belongs to the Papaviridae family. So there are 100 different types of HPV. So sometimes are specific for the mucous membrane. The others can invade the skin. For example, they can cause the plantar warts. So until now, scientists have found 5 types associated with the cervical cancer. So those are the 16, 18, 31, 33, 35. So the other types may cause risk for the vulva and penile cancer. Since the HPV has the capacity to induce the cancer, so this means they have the ability to activate the oncogene. Oncogene means the cancer gene. So they can initiate. So they can cause the production of the proteins to initiate the cellular change to the cancer cells. So now we have the HPV vaccine available. So CDC recommend all the people's children's over 9 years old and teenagers, adults to get this vaccine. So this is so the vaccine actually covers those 5 types. However, even the patient gets the vaccine, they may also so the female may also get the cervical cancers induced by the other HPV types. That's why all the female over age of 30 need to do the pap smear to detect the cells, to detect the cells on the cervicals. Since the HPV is transmitted through the sexual contact, so the protective sexual activity is the prevention method. Now we have the vaccine, so it's recommended for all the people, both male and female over age 9 to get this vaccine. So the prevention method is protective sexual activities and annual pap smear. So the woman should have their first pap smear by the age 21 or within 3 years of their first sexual activities. So the HPV is incurable. Okay, it's incurable. So we can cut the genital warts. However, so we cannot eliminate the virus. Molluscum contagiosum is the virus of the Poxviridae family. So it can cause Molluscum contagiosum. So this virus can also be transmitted through sexual activities. It can cause wart-like growth on the skin. So the virus can also be transmitted through the clothes or towels and auto-inoculation. Now let's talk about the group B streptococcus. Group B streptococcus can cause neonatal diseases. So it is found that 10 to 40% of women in the American have this bacteria without symptoms. So so it will cause any problem for the non-pregnant woman. However, once this bacteria colonizes in the vagina, so it will cause the preterm delivery. So the baby can also be colonized through the vaginal delivery. Now let's work on this question. Infection with what can increase the chance of infection with HIV? So I give you 5 seconds. So the correct answer is E, okay? Because genital ulcer disease can increase the chance of the HIV. So this is the appendix.